One of the things I learned the hard way is that you can't just throw numbers at people and expect them to empathize. Everyone who knew me in college would attest to is that I repeated some facts. One of them was that 30 million Americans, at that time that was the number, 30 million Americans do not have health insurance. I remember thinking, aren't people astounded? 30 million people without health care? Like, how is anyone not freaking out about that? And that's entirely just that phrase, the hardest thing to escape is your own perspective. And that was just me projecting my way of thinking onto others. And ironically, if to my classmates, I had just shared my personal experience as somebody without healthcare, I probably would have gotten people to empathize much more. So that's what I'm going to correct in this video. I'm going to talk about my personal experience with the American healthcare system. So like I said, I've been without healthcare for most of my adult life, and that includes since the pandemic started. I made a video recently about a break I took. Well, part of the reason why it was so long is because I had tonsillitis. And that was that extra little bit of motivation that I needed to think, okay, you know what, I need to get on healthcare. And so I reapplied for Medicaid. Application goes through. Early indications were pretty positive. I called him up. The lady that I talked to gave me a lot of positive signs. She looked over my case like, oh yeah, we'll get you on. And then I get mailed this booklet. And this was pure elation getting this, because this is a booklet that's saying, hey, you're now on Medi-Cal, which is Medicaid on the California level. Choose your plan. There's 2 plans in your city. Which one would you like to go on? Which one would you like to be enrolled on for the rest of the year? I sent it in, and all of a sudden I get an update. You have been declined. When I got this, I had this overwhelmingly positive feeling of, because of all the ways that healthcare would give me more freedom. It would give me the freedom to go see a doctor without having to pay out the... It would give me the freedom to talk to somebody who knows what they're talking about when it comes to me being on the autism spectrum. It's one of those quality of life improvements that's unfathomable to somebody that hasn't had it. Like, it was on the level of, wow, I'm not stressing about rent. I'm not stressing about, can we keep a roof over our heads every month? And to have that taken away, it was even worse. I wish I had just been rejected from the onset. Again, and to think that there are so many more millions of people that have it worse than I do. Cruelness. So now it's time to insert the reality that is the Affordable Care Act, because that didn't save me in this case either. I went onto the exchanges. I basically had 2 healthcare options. Option number 1 was pay $300 to $450 a month and have a $10,000 deductible. Now, if you're not from the United States, you don't know what a deductible is. Basically, what a $10,000 deductible means is that I have to spend $10,000 out of pocket before insurance starts covering me. So unless I have something horribly catastrophic, I'm not going to spend $10,000 in a year. So a $300 a month plan. So I'm spending $3,600 a year on top of $10,000 a year. So I'm spending $13,600 a year approximately before I get a single cent of health insurance coverage. I'm not going to use that. That's a complete waste of money. Option number 2, spend $550 or more. $550? I'm 27. I'm very fortunate to be healthy as somebody without insurance. That's not a plan that's within my price range. It's appalling to me that I even got rejected by Medicaid in the first place. I share a studio apartment. That's the level of income I have. In the past year, which is what they base the income on, they're not basing it off of right now immediately at this moment. They're basing it off of what happened to me in 2020, which included losing a job, which included having to budget for food. That's not the kind of person who qualifies for health coverage through Medicaid? Really? They spent trillions of dollars on those COVID relief packages, and somehow somebody like me can't get health insurance when I cannot afford, I can't. I hope that my story is evidence, not just that we should have Medicare for all, as the vast majority of Americans want, but that the Affordable Care Act is a half measure, it's crumbs, and it leaves people like me with no option. I have no option on healthcare. As if it wasn't cruel enough that there are people who can't get health insurance during a pandemic, but that there are corporations, big pharma, the health insurance industry, they're making bank during the COVID pandemic. Shows you exactly the priorities of this country. That people are not the priority. That happiness and well-being and personal freedom. I'm not free to go see a doctor. I'm not free to go see a specialist that I'd like to see for my quality of life, for my understanding about myself. It's really frustrating. It's really cruel to have been provided, not just with somebody on the phone telling me, hey, you probably get covered. No, literally documentation telling me you will have health insurance taken away. That's cruel. Healthcare system is so cruel.